Hey guys, so this video is for the FM interns. And so I wanted to make this video um, and kind of go over some clinic workflow things. I feel like I've kind of learned a lot of things and like picked up different tips and tricks. Um, and I have a lot of kind of tips that I think are going to really help you guys to be more efficient in clinic. Um, and so this is going to be just informal. I made kind of a list of things just on my phone that I'm going to kind of go through and show you guys here. And so just to kind of start off, so um, kind of his background on all of this, like in our residency clinic, basically we work as a team. So we, generally only are in clinic like 1 day a week. And so a lot of times we're seeing each other's patients. And then we also work with the nursing staff, so they have to deal with their patients. And so if you have like really well managed patients and like clear notes and different things like that, and kind of know how to do things logistically in the clinic, it really helps out kind of all the other residents and all the nursing staff. And then also it's going to give better care to your patients, and they're going to be kind of more, they're going to know what's going on, and it's just going to be kind of a more organized and better flow for everybody. Um, and so let's see. So I wanted to start off kind of saying this. So in primary care, one of the biggest challenges that I found is kind of balancing or juggling like three different kind of often competing priorities. So when you have a visit with a patient, I feel like these are kind of the three buckets that different things fall into. So there's one, the patient's agenda, and that is like their acute complaints or even like chronic issues, chronic kind of like aches and pains or random different questions or complaints that they have. So kind of in any one given visit, you're kind of trying to manage those things. And then as far as kind of our agenda, there's two different parts of it. So there's the managing people's chronic problems. So that's like diabetes, hypertension in those. And then the other one would be the patient's routine health maintenance. So that would include um, preventative screening tests, vaccinations, and then other kind of other like guidance, kind of like the types of things we go over in like a well child visit, but for adults, like guiding them on healthy lifestyle type stuff. So, anyways, those are kind of the three different things that we have to balance when we're doing these visits. And it can be pretty tough, and I'm still have a hard time doing that, but I've put in me and some other residents, as you'll kind of see as I go through this, it put in a lot of work to try to kind of like automate almost some of those things and just kind of standardize it, as you'll see. So going along with like standardizing things, that's where I'll start off on this. And so one project that me and some other residents have been working on this year is standardizing the way we document routine health maintenance. And this has been kind of a project over the last year. So we talked among the different residents at residency meetings. We've kind of voted on different ways of possibly documenting these things and tracking them for our patients. And then we've agreed kind of on this way that I'm going to show you this method. And so I'm going to go over this. So and basically the routine health maintenance, like I said, it consists of, let me move this out of the way. It consists of mainly like screening tests and vaccination status. So what we kind of agreed on is we'll document it kind of in this way. And I made these dot phrases, so they're just on my thing. If you want to steal, if you don't know how to steal the dot phrases, you just go to this copy auto text tool at the top. Then you'll type in my name here and then find them and then copy them. So it's pretty easy. Let's see. But these are the four, let's see. If you type in equals PRV, so these are the four kind of different things here we have. So this is the main one. This one has drop-down menus. There's one that doesn't have drop-down menus, so choose whichever one you like. For me, this one's quicker. But basically, we've gone through what are they, class or group, like the class A and B USPSTF guidelines, and then kind of synthesize them and put them into this dot phrase. And this is updated, like the breast cancer screening just barely changed from, I believe, 50 down to 40 is when we start. So this is updated. And so kind of what we agreed on as residents to do is in the bottom of every note, this doesn't include like a sick visit, like a quick sick visit or a quick follow-up visit for something. But say the patient is seen every 3 months for like their general chronic care management, like to check their A1C for diabetes and all that, then you do include this in all of those notes because we want it to be very easy to find. Because one of the problems was this was you just couldn't find this information, so you'd have to re-ask all these questions every time. And then you didn't know how other people documented it. So basically, use this dot phrase. At some point, I think we need to do a lecture and go through all this stuff because there's just a lot here to know. Definitely, this is something that's very like high yield to study as a new intern that you need to be doing correctly because they're like important cancer screenings and that kind of thing. So yeah, use this dot phrase, and then we put this here in bold. So after you fill it out, then put in the date. And then when you copy it forward into the next note, if you didn't actually make any changes to it, then leave the same date so that we know that it was just copied forward from like X date. And then when you do change it, obviously you would update the date. But then it shows us like, okay, it was updated 6 months ago, then they're due for their annual to review all this in another 6 months, because generally you'd want to go through all this every 6 months. I mean, sometimes sooner, every 12 months, like on an annual basis. So definitely put in the date there. And then this one is another really useful tool. Let me see, equals PRB. So, and this took me an extremely long time to make. So these are the guidelines here. And then, so definitely go over and like study this because there's just a ton here, and you can also study it on like other websites and stuff. But basically for all these things, and it's in the same order as the dot phrases. I have the indication for, so like what ages you do these tests. I have the diagnostic code, and then colonoscopies or colon cancer screening is kind of, there's a lot to it. There's 3 different options, 2 different ways of ordering an actual colonoscopy. So definitely study this, but it tells you the diagnostic code to put in, because the scheduling office is just going to kick back your test. They're not going to do it if you don't have the right code. And then it tells you on the actual order to put in. So definitely go over this. I won't go over this right now in a ton of detail due to time, but so for all these, there's the indication. So when to do it, the actual code, diagnostic code, and then the actual order that you put in to order the test. So yeah, go through all this. And then at the end, I have the vaccine shots. So definitely study this before you're actually sitting there with the patient, so you know kind of how to counsel on the vaccines. And then I also have here like which ones are available in our clinic, which ones they would have to go to a pharmacy for. So there's that, and then yeah. And then the last like dot phrase here would be this one. So this says, I gave the patient the screening questionnaire to fill out and bring back to the next visit for review. So basically, you're generally not going to have time during your visits to review this. That's why it's helpful to have patients schedule annual visits. Some patients just won't do annual visits. It's kind of hard to do that. So that's why I made this form. Let me pull this up. So we have this form. It goes in the same order as the dot phrase, and you can have the patient take this home, because a lot of people, it'll take them 10 minutes to think of when their last tests were, and you don't have that much time in clinic, and you shouldn't be spending time doing that anyways. You should be like counseling on different things. So yes, you can send them home with this. A lot of times, like they're probably most of the time maybe not going to bring it back, but some people might. Another option as well is you can have the nurse give this to the patient while they're waiting in the exam room, and then it's going to speed up the process of reviewing this when you get in the exam room. And then one way to do that is, let me click here. So I can't pull up my actual schedule because it has patients' names, but when you pull up your schedule for the list for the day, you'll have your patient name, and then it'll have a little box over here you can click, and then you can open that and type in a note for the nurse, and then they'll see all those before they room your patients. So you can, like, say your patient needs an A1C that day, just put in needs POC A1C. But you can also put in like, please give patient this form to fill out just by themselves in the exam room while they wait for me. And then it's going to be filled out, and it's going to make your visit that much faster. And then you're going to actually be able to start doing these, because a lot of our patients, they just have so many problems that a lot of times we don't have time to cover this, and then they get really behind in the screenings. Let me think if I have anything else on that topic. I think there's a lot more on that topic to go over, but that's kind of like, basically you need to have this documented in some form in this box down here, that you're at least thinking about it or planning on doing it at a future visit. Because we can't just forget. This is kind of like the third main like component of primary care is routine health maintenance. Let's see. Okay, so then the other component would be managing chronic conditions. So I'm going to kind of run through my workflow. These are probably the most common types of visits. So a follow-up visit for like the management of chronic conditions. So your patients that are on, like this example here of this patient, they're on, atorvastatin. They've got the thyroid, they've got diabetes. So I'm gonna go through kind of how to do one of these visits. I think it'd be useful maybe at another time to talk about how to do like a new patient visit or like Medicare annual wellness visits and those types of things. But I'm gonna go over this one because it's the most common type of visit, so that you guys can be efficient and kind of give your patients good care. So the first part of this happens before your clinic day. So, and not everyone does this. Maybe it's controversial, but I would highly recommend doing a chart review on every patient that's on your schedule at least the night before. And kind of the chart review, if you've ever done an admission for like admitting a patient in the hospital, I would say that's kind of the level of chart review you need to do, like spend at least 15 minutes going through their chart, becoming well acquainted with, go through their notes, like see what specialists they see, look at their medication, see if you agree with the med regimen that they're on, look over their problem list. A lot of these patients, they're problem lists because they've just been passed around to so many providers. No one's really sat down and organized the problem list. They'll have like 30 problems, and half of them are like URI, or like basically acute problems or duplicate problems, and they're all marked as chronic. And so half of those, a lot of times you can delete because they're not chronic. So simplifying the problem list. You can also, this is really helpful too, you can click on it and then put a comment. So say they have AFib and they follow with a cardiologist, right? Just write follows with cardiology, and then it kind of notifies you like, oh, I don't need to, like, I'm not the one managing that. So you don't need to be like taking your time out of your visit to do that, because they have a whole visit with cardiology where they do that. So it just lets you know like, hey, I'm kind of not completely responsible for that problem. So yeah, for me, I do it generally the night before. I'll do a chart review on these patients, and then I also do a bunch of things. I write like most of the note the night before in a way, but when you're doing the chart review, do a thorough chart review. Make sure you kind of agree with what's going on. Look at their labs. A lot of times patients are going to have labs that other doctors ordered, and then they never followed up with them. They'll be like, they'll have been anemic for like 5 years and no one's ever ordered an iron panel or a colonoscopy. So you'll definitely find a lot of problems like that. And then, things that you can do to help the patient. But one big thing though, or kind of going on to the next step in your chart review, is after you look at everything, come up with what you want to cover in that visit and then create your problem list. You always want to walk into the exam room with your agenda kind of set. Obviously, the patient is going to have a couple of problems of their own, and then you're going to have to manage, those things. But you need to have your agenda set before you walk into the room. So you need to have your problems of what is appropriate to cover during, say, their like 6-month visit. That's why they're here. They need to be, or a doctor needs to be managing these issues like their diabetes. They're not just there to, complain about their back pain or a cough. Not that you're not always also going to cover that, but you just need to cover your bases first. Kind of like we talked about with the routine health maintenance stuff, that you have to do that as well. And so, yes, part of the chart review also is doing that kind of as best as you can, like seeing what tests they've had, and then you can kind of put them in that dot phrase if you want to. So there's that, coming up with your problem list. Let me see if I have anything else. Yeah, and then as far as starting on the note, you could or you could not start on the note. It's up to you. Let me see. So now it's kind of the morning of the clinic. So you walk in and see your patient. Kind of when you walk in, make sure the patient's aware, like tell them that you're going to cover, like say, hey, how's it going? Like, we have some things to cover today. We're going to talk about hypertension, cholesterol, and diabetes, but what's on your agenda for today? Like, what do you want to talk about? Just so you set the agenda up front and can make sure you have enough time to cover everything. So I think that's important. I'll just talk about the notes right now. So as far as notes for like these follow-up visits of chronic conditions, and this is totally just my style. I feel like it works pretty well though. I'm super, this is what I've been doing for the HPI and then the ROS and then physical exam. I don't always do the lower extremities. I always do heart and lungs. Actually, if it's like a derm thing, not always, or MSK, you don't absolutely have to listen to the heart and lungs, but so that, I think for billing purposes, you used to have to like write it a bunch on the HPI, but now you don't have to. And it's not that I don't do an HPI, I just feel like it's faster if everything is under this problem. So like say someone else or you are looking back at the note, and you're like, hey, I want to know like how this patient's diabetes was for this visit. For me, it doesn't make sense to have it in two places, like info about their diabetes, both in the HPI and in the ANP. So I just put everything here, and I feel like it's faster to write the note and easier to read and look up information. I feel like people don't look at your H&P or your HPI anyways, even if you do write stuff there. So yeah, separating that into these sections can help. Let's see. Oh, and then another thing as far as notes is a lot of times I'll put things in bold that like, say someone else is seeing my patient during their next visit, I'll often put things in bold that I like absolutely want them to follow up on. Like I'm like, hey, you can't forget this thing. And so I'll put that in bold. Just so it doesn't get missed. And then just quickly, I don't use this that much anymore, but as far as having a reference, I feel like obviously most people use UpToDate and that's a good reference. It is useful in clinic though to have some type of like quicker reference that presents things in a bullet point form. Like when I was an intern, almost every day I would use, it's called the 5-Minute Clinical Consult. It's an app. They also have a book, but the app is pretty useful. I'd recommend that. It is $100. There's also another app that's free, I believe. It's called FP Notebook, and it's a bullet pointed one. But I'd recommend finding something that's like a bullet point type of reference to just really quickly look stuff up. And then also like Diagnosaurus is a really good app for looking up a differential when you're in clinic. So I use those two a lot, or at least I used to in clinic. Let me see. And then one other thing as far as billing, and then I'm going to get into a bunch of stuff about orders. One thing as far as billing, a really good app, I think it's only on the iPhones, but it's called Visit Coding. Visit Coding. It's super helpful. Whenever I have a question about, because basically you're going to bill like 99% of the time, either a level 3 or level 4, but some of them are kind of tricky. But I just pull that app up, and then you kind of, it just asks you like, you know, did you prescribe a medication this visit? How many problems did you cover? It just kind of works you through, and it has like an internal algorithm. And then it spits out what level of visit it is. So if you ever have any questions about billing, it doesn't have stuff on like the annual visits or Medicare visits. But as far as those like levels 1 through 5, I would use that app, and it's free. Okay, so now for orders, and I think this will be huge as far as helping you be efficient. Let me see. It just kind of in general, I would recommend using this tab to put in orders. I feel like it's a lot simpler than using like the QOC thing. That's what they told us to use in orientation, but this, I feel like this is a lot easier here. But anyway, the main part of this though is let's see, is order favorites. So I would say to copy, I'd like highly recommend people copy my at least three of these. You can do all of them if you want, but cardiopulmonary tests, clinic labs, and then preventative screenings. I'll just quickly run through these. So cardiopulmonary tests, this is going to be like 90+% of the cardiopulmonary tests you order in our clinic or as a primary care doctor. And so it's just all right here. And then like in each of them, I would copy them directly from this because I put in like CMC test, like you have to have that in order for it to be sent to the scheduling office. So all of them have that. This is the X-ray. It's specific for like the lung views, PA and lateral views, upright. So definitely copy those. Clinic labs. This is the majority of the tests that you're going to order. In clinic, like it has the correct iron panel. You always want to do the one with ferritin. It's got the correct vitamin D. Yeah, so I would use that. And then lastly, preventative screening tests. So this will really speed up when you're trying to order, when you're doing those preventative screenings that we talked about. So these are all the tests, and they have all the little things put into them like CMC tests so that it's actually scheduled. This is the referral for the colonoscopy, and I put in kind of some info so you don't have to retype it in every time. So definitely steal that. Those are all the screening tests pretty much that you're going to use. And then there's other ones too you can look at. And then just real quick of how to steal those. Look at the other video for inpatient, but for primary care or outpatient, I mean, you have to be at an outpatient encounter, then go to primary care QOC, do shared, and then type my name in, and you can steal those right there. Let me see what's next on my list. Okay, so now we're kind of ending the patient visit. So we talked about this form already. So this form I use for all my patients. I don't know how many other residents use forms like this, but I've sent this to everybody and said that anyone can use this. I have it, I can send it to you if you want, but it's on the shared Google Drive. I would highly recommend using this, especially as you're starting out. So I'll kind of walk through the different parts of this and kind of the benefits of doing this. So first off, just having a form in general, I personally think it like increases patient satisfaction if they have kind of like a token of the visit, you can think of like a physical object to take away. They kind of feel like they got something out of the visit. So just in general, having any kind of form helps with that. First here, putting your name. Since patients often see so many different doctors in our clinic, they won't remember your name, or they'll be like, who is that doctor that I saw? Like, I want to see them again. So definitely put your name. Then notes. At first I was writing like way too much here. I'd be like kind of brief just because you don't want to spend half your visit writing notes, but for obvious reasons, it's important to like write things in the notes section that are pertinent. Follow-up. So I put this one in bold. When I was an intern, I'd often like forget to schedule a follow-up with the appointment or with the patient, and kind of stress the importance of that. So definitely that's one of the most important things is like, and this is kind of a skill too of learning like when an appropriate follow-up time is for different conditions. I would say err on the side of like following up closer rather than like, oh, just come back in a year or two. Like err on the side of having them back sooner. It also just makes, for other reasons we'll talk about, it makes your life a lot easier and the nurse's life easier if they're seen in person more often. So this one is huge here. Ongoing prescriptions have been refilled until next appointment. So our patients are, you could say, like very poorly trained. They think that whenever they need a medication refilled, they should just call our clinic. And some of the patients don't think they need to be seen in clinic. So some of us are like trying to, push this and break the patients out of this habit. But I've gotten in the habit now. I use this form obviously, but I kind of don't let the patients leave the exam room until I've gotten all the meds refilled that they're going to need over the next interval. So like say they're following up in 6 months with me, I tell them, I'm like, okay, you don't need any more meds refilled, right, until 6 months. And they're like, oh, actually, like my metoprolol runs out in 3 months. I'm like, okay, let me put it in right now and give you a bunch of refills. Because, and it's not that bad. Definitely as an intern, you're not gonna be drowning in this, but as an attending with a panel size of over 2,000 patients, if all your patients were calling in for their refills, you'd be getting like at least 100 phone calls a day probably. Like right now, and my numbers have gone down on this because I've gotten better, but the patients are like, I'm still getting probably 1 to 2 refill requests per day, like Monday through Friday, which obviously is too much because to do that safely, you have to review their chart. That's at least 5 minutes in the chart and clicking buttons. So you just need to do everything during the in-person visit that you possibly can. And just in general, you want to limit any communication outside of the face-to-face visit as possible. One, for your own time right now. Two, because you'll drown as an attending doctor if you're not doing that. And then three, because anytime a patient calls in, the nurses have to like field the phone call. So the nurses, and like I say here, if a patient has a question and calls in, it goes to voicemail, and then the nurses listen to the voicemail, and then they communicate with the doctor or the resident, and then we have to give them feedback, and then they have to call the patient back. So you can see like 3 or so different steps for the nurse, and then 1 step for us, 2 different encounters kind of for the patient. So it's just like all this unnecessary communication that for so many people if we're not doing this. And then also if your patients are in bad habits and then they get passed on to other residents aren't going to be happy with you. Okay, so next is making sure they do blood work before their appointments. This is something I started doing a few months ago, but this is another thing to really cut out these phone calls between visits. So patients absolutely need to be doing their annual labs like a week before their annual appointment, and then you discuss the labs face to face. Then it's better for the patient, they get out all their questions. You know, with you, like they can talk directly to the doctor. Because as an attending, some attendings will just have their nurse call the patient, but then the patients don't like hearing this type of stuff from a nurse. They want to hear it from the doctor and have, you know, physician explain it to them. Okay, and then quickly through the rest of this. So make sure the patients are scheduling their annual visits and like aware that that's on their radar, even if it's not for like another year, still just put it there so it's on their calendar. I have these numbers here for reference so that this can also serve as like a reference sheet. Whenever you're sending in a referral for a patient, write the name of the referral here, like cardiology, and then circle this number and tell them if you don't get a call from the referral center within 1 to 2 weeks, call this number. Because I don't know why, but like half the time the referral people don't end up calling. I don't know if it's the patient's fault, but it just falls through a lot. Same with imaging tests. A lot of times they don't get scheduled. So write the name of the test, like brain MRI, and then circle that number, and then tell them if you don't get called to schedule it within a week, call this number. But yeah, this kind of covers so many different questions and like speeds up the workflow of the entire clinic so much that I'd say to really use this, or at least make sure you're doing all this. Let me see. I think I just have a couple other points I wanted to get across. So if you're calling a patient for anything, basically, write just a quick free text note. So it's documented in the chart. An app to use for that, or the app to use is Doximity. They'll probably show you that in orientation. You set the number to our clinic, so it looks like you're calling from the clinic. And then I won't go into this, but I would say limit any use of the portal as much as possible. If a patient wants something and this would be appropriate, then just tell them, hey, we'll talk about that at your next appointment, or like, hey, we offer same day or next day appointments. That this is something that needs to be evaluated in person. Come in or call the office, come in tomorrow for it. And don't try to like be a portal doctor and do all that. Let's see. Oh, and then a couple other things. So as far as the message box, so check the inbox and also this pools one every day. Not on you don't have to do it on the weekends, but make sure you're checking it every day because you'll get labs back and things from patients. As far as under the pools, you'll get mostly it's going to be stuff from the pharmacy that you can kind of just reject and then put a note, like click the button that says patient needs to call our office because we don't respond to the pharmacies. And then sometimes you'll get refill requests that patients send in from the portal tool. And then those ones you do need to refill or at least call the patient or do something with. Don't just ignore those. In general, like on the patient's end, when they put in a portal message, it tells them, hey, if this is an emergency, go to the ER, call 911. The portal's not appropriate for emergencies. And then it says that they should hear back from their doctor or nurse within 48 hours. So just kind of know that. And then, sorry, I'm trying to make this video too long. Oh, and then quickly, if you're doing a controlled substance, click here on the opioid review, and then click view report, and then look at the report, see if it's appropriate, and then click here, and then click mark as reviewed. This is like a quality metric for CMC that we're checking the PMP and then clicking that we've done it. And then I think the last thing I have is just if you need blood pressure logs, glucose logs, or record request forms, they're all available in the little folder in the exam rooms. And I think that's it for this video. There's a ton of, obviously, as you can see, there's a ton of different things you could go into. So maybe at other times we'll like talk about this stuff more, but let me know if you have any questions about any of this. But thanks for watching the video.